Hello everyone, myself K Kavya and I'm going to speak on the topic dosage calculation in UV therapy, ultraviolet therapy. First, introduction to UV therapy is also known as ultraviolet radiation. Is a form of electromagnetic radiation with wavelength ranging from 100 to 400 nanometers. Based on wavelength, UV radiation is divided into three types: UVA, UVB, and UVC. UVA is the ranges are between 315 to 400 nanometers. The longest wavelength penetrates deeper into the skin, which produces pigmentation or tanning. It's a less erythemogenic. UVB, the ranges are between 280 to 350 nanometers, which is responsible for erythema or redness and stimulates vitamin D production. It is commonly used in treating poscariasis. UVC, the ranges are between 100 to 280 nanometers. It is the shortest wavelength, strong bacterial effect, and mainly used for sterilization and treatment of infected wounds. UV therapy is commonly used in poscariasis, acne, vitiligo, chronic ulcers, and wound healing. The importance of dosage calculation. Why to calculate UV dose? It ensures safe treatment, prevents burn and excessive skin reaction, and provides optimal therapeutic effect. It allows accurate progression of treatment. The principles are dose depends on intensity of radiation, distance from source, exposure time, skin sensitivity. The minimal erythema dose definition. MED is the minimum UV radiation dose that produces visible redness erythema within 6 to 8 hours after exposure. Importance. Basis for calculating treatment dosage varies among individuals, determined before treatment begins. Uses establishing safe treatment levels, monitoring patient response. Determination of MAD procedure. Select a small skin area, cover skin with text template containing windows, expose each window for different durations, observe skin after 6 to 8 hours. The shortest exposure producing redness in the MED. The example: 30 seconds will be having no redness, for 45 seconds will be having slight redness, and the MED is equals to 45 seconds. The inverse square law. The principles are: intensity of UV radiation varies inversely with the square of the distance from the source. The amplifications are: increasing distance reduces intensity, decreasing distance increasing intensity. Distance must remain constant during treatment. The examples are: distance double, intensity becomes one-fourth. The calculation formula are: the relationship between time and distance. When distance changes, the I1 by I2 is equals to D2 square by D1 square, where I1 is equals to original exposure time and I2 is equals to new exposure time. And the D1 is original distance and the D2 is new distance. The purpose is to helps to maintain the same UV dose despite distance changes. The example of dosage calculations are: problem MED is equals to 1 minute at 50 centimeter, treatment distance change due to 100 centimeter, calculations new exposure times. Solution: T1 by 1 is equals to 100 square as mentioned in the PPT. Treatment dosages based on MED are: common UV doses are sub-erythema dose less than MED, no visible redness; erythema dose equal to MED, mild redness; supraerythema dose greater than MED produces strongest skin response. The clinical uses are wound healing, psoriasis, ache, vitamin D production. The precautions and the contraindications, which are very main to use any therapeutic machines. Precautions are protect eyes with goggles, monitor skin reaction, avoid overexposure, maintain correct distance. The contraindications are photosensitivity disorders, active skin cancer, severe systemic illness, use of photosensitizing drugs. Now indications: psoriasis, acne vulgaris, vitiligo, chronic eczema, delayed wound healing, pressure sores, vitamin D deficiency, certain superficial skin infections, leg ulcers. Now, summary. MED is the foundation of UV dose calculation. UV dose depends on time, intensity, and distance. Inverse square law governs UV intensity. Accurate calculations ensure safe and effective treatment. Regular monitoring prevents adverse effects. Thank you.